Welcome to the Pause and Effect podcast, where we delve deep into the world of veterinary medicine and surgery to keep you informed and your pet companions healthy. I'm Dr. Kara, your host, a dedicated veterinarian with a passion for sharing valuable information. Today we have a special guest joining us, Dr. Inke Helm, a veterinarian from Hillcrest Veterinary Hospital in KZN, with a special interest in surgery. Together we'll be exploring the critical topic of the emergency of urinary obstruction in cats, shedding light on its signs, causes, the diagnosis, treatment, and long-term management. Let's dive in. Thank you, Dr. Inke Helm. You're from Hillcrest Veterinary Hospital. You're obviously one of my colleagues, which is why I've been desperate to interview you, because you are a wealth of knowledge. In particular, you love surgery.
Yes.
That's your area of expertise. However, I've recognized that I've neglected the cats. And part of the reason why I wanted you here today is I want to have a little chat about some of the common cases that we see in cats, in particular the emergency cases. And you have just acquired the most beautiful little kitten. And so I thought, I have to talk to you because you're just as in love with cats as I am.
Yeah, I'm a cat person.
You are a cat lover. So how's your new addition?
He's doing well. My other cats didn't like him much in the beginning, but they've started playing with him now, so it's good.
Oh,
so we'll see. But yeah, he just wants to play with everyone. So.
And he's a Mancoon and he's already huge.
Yes, he's only 10 weeks and he's like 1.8 kilos. So
Unbelievable.
Yeah.
I know. We're loving the fact that you're bringing him into the practice and we get to see him grow up. He's so cute. So I realized not only do I not talk or do I interview people enough about cats, but one of the things that I keep recognizing is we get that phone call that comes via the receptionist generally, and it's the Dr. Inke, Dr. Kara, have a client on the phone and they say their cat is struggling to urinate. So I want to start with sort of the presentation. That's generally what we get. Obviously, we get them coming in as emergencies and owners maybe don't recognize what's going on. They just say, like, the cat's crying out, and we'll talk about some of the signs. But one of the main things we get is my cat's struggling to urinate. And generally the first question I ask the receptionist is it a male or is it a female? And I'm starting with that because obviously this whole condition is very different in males and females.
Yeah.
So can we start off with why? Like, why is it that males and females show urinary issues differently, just from an anatomical perspective?
So males, their urethra is really small, and especially neutered males. So if you look at a male that's unneutered, their penile anatomy is different than the neutered males. And it seems that their penis becomes a bit smaller when they're neutered. And so then if they get some sort of bladder infection or they get stressed or they have stones or any of those things, they can get blocked up. And then you're looking at an emergency, because if the bladder, if they can't get rid of the urine goes back into the kidneys, and then you have a lot of waste products that gets into the actual system of the cat, and then, they get really sick and they can actually die. So for males struggling to urinate, it's a dire emergency. For females, it's very rare for them to block up because the urethra is bigger. And chances are, if they do have stones, they will be able to pass them depending on the size. But it's not to say they can't block up. So, in rare cases, they still also can block up.
So the females, from my understanding, is that they have generally slightly wider urethra or shorter, and so they don't tend to block. So when we have the question that we're asking our receptionist is it male or female, what we're trying to determine is, are we dealing with a cystitis, which, yes, is terribly painful for any woman who has struggled with cystitis, and inflammation of the bladder. It's really, really sore. So they're going to be showing the same signs as the males, but generally males don't get a cystitis in the same way as females. They block up. And now you're saying that becomes a medical, sometimes a surgical emergency.
Yes.
Is that right? Okay.
Yeah.
So let's put aside the females for a second. We can obviously talk about them because they are relevant. But let's talk about the emergency situation and this blocked male now coming in.
Okay.
Obviously, what are the kind of typical signs that owners need to be aware of that might indicate that their male cat has become blocked?
Okay, so you'll see your cat going to the litter box quite often, or if they're going outside quite often and they're trying to urinate, but they can't, they're straining, and then they start vocalizing and pacing up and down. And some of them, their penis actually gets extruded and they lick it the whole time because it's blocked and they want it to open up. So they're trying to open it up themselves. And we actually found sometimes people would come in and say their cat's straining to defecate, but it's actually they're straining to urinate. And so those ones you also need to be aware of. Sometimes it's not constipation and sometimes it is a blocked bladder. It's just the signs can sometimes look a little bit the same.
So, I mean, some of the common reasons why our cats might be straining is obviously a cystitis in females, blocked, like you say, a constipation, maybe even a diarrhea. Is that right?
Yeah.
So any straining needs to be examined, and it's very difficult to say for an owner. I mean, it's very quick for us, especially in cats, because we can just easily palpate that bladder.
Yeah.
So they're straining, they're vocalizing. Sometimes cats are very discreet and they go and urinate far or out of sight or at night. So sometimes, like you said, that vocalization, or they're just not right. Hair stands on end.
Yeah, and the problem is with these, you want to pick them up in the first 24 hours because after 24 hours, they generally come in flat. They have high urea and creatinine in their bloods, which is waste products that generally get excreted out, which they can't now. So that builds up in the blood, and the electrolytes, they have a big imbalance in the electrolytes. Their potassium can be high, which can affect the heart. So you want to see them in the first 24 hours and sort them out, because after 24 hours, it's literally a life or death situation for them.
Okay. So let's talk about the kind of clinical signs that obviously maybe owners are not aware of, the things we're looking out for when we get presented with a male that might be blocked. So you spoke about the heart. Like what are the kind of changes that we notice in these patients that indicate maybe the how severe it is or how long it's been going on for? What are, in terms of our clinical examination, we obviously can palpate a very full bladder,
yes,
but what are the other things that we can do in terms of from a clinical examination perspective and bloods? So take us through the typical.
So you'll obviously it depends on when they come in, but from a clinical point of view, you'll do your full clinical, and you can sometimes pick up arrhythmias and things in the heart, and that's now if they're blocked for a long time, and you feel the bladder, and the bladder feels big and it feels hard. It's very turgid, and when you push on the bladder, they will vocalize because it's so painful and they can't urinate. So generally, if you have a normal cystitis and you push on the bladder, they should be able to urinate. But now they can't. And now you're also dealing with, you can't press it too hard because you can rupture the bladder if the bladder is blocked. And then generally what we do, our first thing is to put them on a drip, sedate them, and get a catheter in just to relieve that bladder. And then we do bloods, because we want to see, generally it's a acute kidney injury just from the urine backdamming to the kidneys.
So acute, just for the listeners, meaning it's happened within a very short period of time. This is not a long-standing condition.
Yes, yeah. So it's happened, yeah. We call it post-renal azotemia, but I don't, I'm not supposed to say that.
No, you can.
Okay. Anyway, so then you do blood work and you look at the urea, the creatinine, the phosphate, and you look especially at the electrolytes. And then when you sedate the cat, you need to be careful of what sedation you use as well, because if you have high potassium in the blood, if you use certain sedations, you can actually cause them to to die because the potassium is toxic for the heart. So you need to be really careful with your sedation. And then the main thing is relief, and then you have to do a urine analysis. So you get some of the urine, and generally you'll see the urine as bloody. Sometimes there's little like gritty material in the urine, sometimes they're blocked and you're struggling. Because
so what do you do if immediately you know that this bladder is huge and you need to provide, just even if it's temporary, release of pressure on that bladder?
So you can always do what we call a cystitis. So you can stick a little needle in, a really small needle, and just relieve some of the pressure. And it'll also give you time to actually take an X-ray and to see if you're dealing with stones, or if it's just your idiopathic feline cystitis you're dealing with. But you can. But your problem with that is also you need to be careful. If the bladder is too big, you also don't want to rupture the bladder. So
you're weighing up a lot of the science, sort of how turgid the bladder is, the kind of state that the cat's in. You spoke about the heart rate. One of the things that I was always so surprised by was how low their heart rate are, considering the level of pain and discomfort, and that's obviously due to that imbalance in electrolytes. So I think owners often are like, but their hearts are fine. In fact, it's generally on the low end, isn't it?
Yeah.
So I think probably I want to take the opportunity now to say this is obviously an emergency situation.
Yes.
And one of the things we have to discuss with owners is whether they want to see this through, because there are costs associated with veterinary treatment. Obviously, most people do, particularly if it's the first time. But from the studies that I've read, I think between 15, and correct me if I'm wrong, 15 to 35% of these can recur.
Yes.
And we'll talk about, the possible things that you can do to mitigate that in a bit. Hey there, fellow pet lovers. Today, I am thrilled to share with you a new treat on the market, Plant Dog, the innovative plant-based treat that's been a welcome addition to my pet's routine. As you can imagine, as a veterinarian, I'm particularly fussy about what I feed my dogs. Finding a treat that ticks all of the boxes was a real game changer for me. What I love about Plant Dog is the versatility it offers. Picture this, I'm treating my 4 dogs, each with a unique tastes and preferences. With Plant Dog's snappable design, I can effortlessly divide the treats into equal sections, ensuring each of them gets their fair share of crunchy, tasty goodness. And quickly, or the salivation starts. And let me tell you, their reaction is priceless. As soon as I call them from the gate these days, they come bounding over like it's the highlight of their day, which, let's be honest, it probably is. Plant Dog never fails to capture their attention and affection. Available in 3 flavors of bacon, burger, and barbecue chicken. But it's not just about the taste, it's about the quality too. Plant Dog's commitment to using organic, wholesome ingredients gives me peace of mind of knowing that I'm providing my pets with treats that are nutritious as well as they're delicious. With added omegas, antioxidants, and a complete absence of artificial additives and preservatives, it's a win-win for both pets and pet parents alike. The treat's outer is made from organic rosehip berry, picked in the mountains of Lesotho by over 10,000 women during a short 6-month picking period, with added organic flaxseed, organic rosemary, and organic yeast. And let's not forget about the packaging. It is beautifully packaged and conveniently allows me to grab a treat on the go without sacrificing freshness or flavor. So why not treat your dogs to the goodness of nature with Plant Dog? Trust me, they'll thank you for it. Stay tuned for more of my personal recommendations straight from one pet lover to another. Before we continue, let's address a critical aspect of pet care, gastric health. Introducing UltraPet's Special Diet Gastric Liquid Care, formulated to aid pets during recovery from gastrointestinal issues. This versatile product boasts a balanced formulation with 31% protein, 9% fat, and 3% fiber, replenishing key nutrients essential for pets recovering from gastric issues. Featuring a delicious chicken flavor, it is highly palatable, encouraging pets to eat during recovery. I've had great success using this both with tube feeding and syringe feeding patients. What sets this liquid care apart is its comprehensive approach to pet health. with added prebiotics for digestive health and omega-3 and 6 for immune support. It is a holistic solution for upset stomachs. Ultra Pet's gastric liquid care comes in a 750-gram pack, providing an optimal solution for pets in need. Give it a try and witness the difference it makes to your pet's recovery. Your companions will thank you, and you'll appreciate Ultra Pet's dedication to pet health. Now let's return to our conversation. Some of the expense associated with managing these conditions can actually, make some owners make that call at that point.
Yeah.
Because we do need to keep them hospitalized for a period of time and manage them.
Yeah.
Correctly.
So it's one of those, you go all out or you do nothing, which sounds terrible, but if you can't just sort of stabilize for a few hours and send them off. Like, that's not how it works. You have to have a catheter in for 12 to 36 hours just to get that bladder to also heal. And a lot of owners make the decision, to rather put them to sleep, especially if they're old or if it's a recurring one. And there is a few things you can do if you have recurring blockages. You can do surgeries, where they remove the penis basically and make an opening that they almost like a female cat. But it's cost. There's a lot of cost associated with that as well. Yeah.
So if owners are in a position and it's a recurrent case, they can opt for surgical management in terms of that shortening and change in the anatomical position of the urethra. So they urinate, like you say, like a female.
Yeah.
Okay.
Yeah.
So take us through the catheterization. Obviously, I'm wanting to talk about it because sometimes owners are shocked if I don't warn them of what they're presented with when they come and visit their cats. One of the first things they go like, why are they wearing a cone?
Yeah.
Can you talk us through sort of, what owners can expect and why? Because, whether it's an open or a closed system in terms of collection of urine and the cone and
So unfortunately, because we need to, so with a big bladder, what happens is the muscle fibers, they lose their junction. So you have to have like a free flowing system for a 12 to 36 hours, which means the catheter needs to be indwelling. So it needs to stay there. And there's only a few things you can do to actually secure it. And the one we do basically is, so we'll catheterize them. You get the right size and you empty the bladder and you flush the bladder and everything's fine. And then you suture the catheter to the sheath. Okay. So
to the skin, to
the skin. Yeah. Sorry. Yeah.
No, just so that listeners don't think we're tucking into the...
No, it's not into the penis, but like the skin around it basically. And it's to keep it in place so that you can have that where the bladder can actually heal. It doesn't need to expand or contract or anything. You just have free flowing urine out. So you have to put it there. And then obviously cats can be quite nifty and if it irritates them, they'll pull it out. So you have to put a cone on so that they can't reach the catheter. And we do have some Houdini cats that still do. And then we need to make other plans. And then sometimes it will be scary because ideally you'd want a closed system. So you'd want like a urinary bag basically attached to it. So in most practices, what you'll find, it's basically a bladder, a drip extension set attached to an empty drip bag, just to keep it close because you don't want bacteria going in and out.
What I love about those, though, is also the ability to assess the amount of urine then that's collected. And obviously, we talk within our clinical notes every day about the color of that urine. So lots of things that we can gain by visualizing then the progression of the disease or whether the poor cat is healing.
Yeah, exactly. And also with that system, then if you do use some of the urine in the bag, just to recheck if there's any infection now or what's going on. It's sort of in a sterile system, so there's nothing that could have gone in that would, make your results not, or incorrect, not valid, So it can be quite scary, because we generally, with the bag, we attach it. You can attach it because obviously you don't want it to pull on the cat's skin there. So you basically have to secure it to the tail. So you do just tape wrapped, micropore wrapped around. And it is irritating for the cat, unfortunately, but we have to do it.
And one of the things I think that I try and reassure owners at the time is, with the medication that we use in order to manage some of the pain and the discomfort, there also are generally some sedative properties. So they're not as, we want them to be better by the time they go, but they're not as aware as they would otherwise be. So in terms of the medications, I know that this is obviously dependent on how progressive the condition are, but how do you generally tackle it? What do you base it on? What is a dipstick, for example? What do you
So when you get the urine, you'll do your SG, which is the specific gravity, which would actually, it'll tell you also sort of the function of the kidneys, and if they're still able to concentrate urine or not. And generally they are, even though your blood results are showing you that there might be kidney disease, and that sort of forces you to look at it might be acute. And then you do a dipstick, and a dipstick tells you if there's blood in the urine. It tells you if there's proteins in the urine, if there's glucose in the urine, and it tells you what the pH of the urine is, which is also quite important, especially if you have cats with certain stones and crystals and things in the urine. And then after that, we look at the urine under the microscope. So we look for crystals, we look for any bacteria, we look for any inflammatory cells, and most often 95% of these cases are sterile bladder infections, and they're not due to bacteria. They actually say that if your cat's 10 years or younger, there's less than a 4% chance that this is due to bacteria. So people think, it's just a bacterial infection, but it generally isn't. So that's what your urine analysis will tell you. Look, if it is a bacterial infection, then it's good. Then you can start them on antibiotics. And then you have to start them on anti-inflammatories because they're inflamed, because that bladder was so distended. And also you've passed a catheter, which is also a bit irritating to them. So your anti-inflammatories, and then you can add extra pain medication, which can also help for their demeanor and make them feel a little bit better. And then if you have a cat that's blocked up multiple times, you can start with drugs that can help with the muscle spasms and to just relax the urethra. Yeah.
Okay. No, that's great. So maybe this is a good point for me to say, are there any predisposing factors that owners can mitigate the risks of their male cat becoming blocked? Yeah. So what are the contributing factors to these cats? Obviously, like my gut feel here is most of it is sort of a genetic predisposition. Yeah. But there are obviously certain things that we see.
There is things that you can do. So they actually say if your cat's just on dry food, it actually causes them to be more prone to getting blockages or cystitis if it's a female. So dry food. So I would add a little bit of wet food.
Or at least make sure there's access to water, especially in our kind of climate.
Yes, yeah. And then obviously, the water. They have to drink enough water. And then also they say feeding frequency actually can increase the risk of them developing it, which is something new that I read, which I didn't know. And then they say indoor cats. indoor cats are more prone just because they have a more sedentary sort of lifestyle. They don't move a lot. So if you do have cats that are lazy and just lying around the whole day, make sure you play with them, get them moving a bit, because that also helps. And then multiple cat households, unfortunately.
Is that a stress factor?
Yes, it is a stress factor. And people would say, look, I have 4 cats and they live happily together. And it's true, but you have to remember cats' territories are quite big. And these cats' territories are overflowing, and there will be a little bit of a stressor. So you can put pheromone diffusers or pheromone collars or things on them, just to help them be more relaxed. And then litter trays. So they say outdoor cats are less prone to getting blocked because they're sort of outdoors and doing their thing. Litter trays, you have to have the number of cats you have plus an extra litter tray. So, and you have to have it sort of a little bit spread out, especially if you have a cat so that's very territorial about where they go, so that it's not a stressor for them to actually go to the bathroom. So they don't want them to keep it in.
They don't want to use dirty trays. Sometimes they don't want to be visualized going into the litter tray. So some of them, like even having a combination of open and then closed litter tray so that they've got privacy. Yeah. Is that right?
Yeah, so you need to get the litter tray that's the best for your cats. And yeah, like I said, an extra litter tray.
So if you've got 4 cats, you need 5 litter trays.
Yes.
Okay. Yeah. And how does that work also with bowls? Would you say that also you need multiple water sources?
Yes.
Does that the same applies?
Multiple water sources, especially if you have like a 2-story house, have above and have below, and and don't, or you can feed them together because cats actually are fine feeding together. But the water sources can be on different places in the house.
I mean, my cats always demand the taps open. I always feel bad. I always wonder who's opening the tap for them during the day when I'm at work.
Yeah.
But now we're seeing water fountains, and there are lots of different. Cats like to be able to select where they drink from.
And it gives them a bit of environmental stimulus because, they'll probably love drinking from a stream outside. But if they're inside, then you have to give them some enrichment. Yeah.
And so, the pheromones, I mean, because this is probably, a nice, that we, even within our hospital, we pump pheromones into our cat ward. We try and minimize stress in every possible way. These indoor cats, it's relatively easy to plug these pheromones in multiple rooms, or the rooms that they spend the majority of the time in.
Yeah.
Just to make the assumption that in a multi-cat household that there will be some stress at some point, not all the time, but that there will be.
Yeah, and if you buy them, they'll tell you how many square meters it covers, so you can sort of decide which rooms you wanted and if it'll be enough for a room. And
and they also come out in sprays that if you've got a particular area or you're traveling with them, you can spray them, and it's a bit
or
more
the
mobile.
little collars.
So let's talk about, I mean, you made mention of the sedentary lifestyle and them not moving around. Obviously weight, I believe, is quite a big contribution. Is that both from an anatomical thing, that the bladder is not under the normal pressures because of the positioning within the abdomen, or like how does weight, is it just that they're not more active? Why is it that these larger cats are struggling?
It's mostly because they're not more active.
They don't want to get up to their water bowl and
yes. So and it's also I think it's more with regards to them moving around. It's also a mental thing. A
stressor.
It helps alleviate stress, and it gives them environmental enrichment, which is what you want to get a cat with less stress.
And would you say there are any breed predispositions? I mean, like, I know we started our conversation with your beautiful new Mancoon. Are there any breeds that you find that are sort of particularly prone, or is this just any male cat between, like 2 and 10 we tend to see? Is this just
I would say any male cat. I mean, there are some predisposition for certain stones. Like you get your ragdolls and Persians, and they're sort of more predisposed to a certain type of stone, if that is the cause of the blockage. But I would say it's mostly any cat, and it depends on the diet as well. So if you have diets that they're on with high salt content or high magnesium or phosphorus content, yes, they taste nicer, but it can also lead them to crystal formation and to stone formation.
Okay, so good quality diet is ideal, and one that people can recognize is balanced and well formulated. And then I think, probably the one thing I wanted to, especially with your area of expertise, the one thing I wanted to ask you about is the time I remember being totally stumped with a blocked bladder, and I could not pass that catheter. And obviously the trauma that's associated with trying to pass the catheter, and it is a technically tricky thing. We've done a lot of them. We do a lot of emergency work within our practice, but it's in order to not traumatize that penis and potentially tear the urethra. The one case that was a nightmare, to put it bluntly, I think you scanned and we discovered that actually there was a cancerous growth. Yeah. So obviously we see those cases more when they're older, the transitional cell carcinomas or the likes that can also occlude the urethra and cause very similar signs. Is that right?
Yeah, so you generally, there can be a lot of causes for them to get blocked, but you start with, most often, it's the feline idiopathic cystitis, which is, we just don't know what the cause is, and we see that it might be related to stress. And
they're more like a plug than an actual stone.
Yeah, so what happens is if that bladder gets blocked or the bladder gets inflamed, there's this a mucoprotein that basically gets secreted, which causes this mucus plug, basically. So it can be that. It can just be a spasm if they've been blocked before. It can be a bacterial infection, but it can be stones. And then generally you do your x-rays, and if you're still struggling with this cat, your next step is ultrasound, and then you can see if there is any cancers. And some stones, so stones less than 3 millimeters, you can't always see on x-ray, but you can see them on ultrasound. So I don't know, I like to do, when I collect urine from a bladder, for instance, I do it via ultrasound, because it just gives me an idea quickly of how the bladder actually also looks, and if we're dealing with stones or cancer or something like that. And
so you look, and you're obviously very proficient when it comes to scanning. You look at the state of the bladder wall.
Yes.
So you look at the thickness, and often they're quite inflamed, aren't they? On the scan.
Yeah.
But you can also, I see you shaking that probe to see if there's any movement or any sediment that's collected in that bladder. So what I love about ultrasound is obviously it's non-invasive.
Yeah.
And like you say, even with guided cystitis, taking that sample of urine, if you either want to visualize or you're struggling and it's a small bladder, gives you an opportunity to do that. So going back to the potential of the flap with a cancerous kind of growth, those generally are sort of partial obstructions. So sometimes they pass, and often when we sedate them, they relax, and then
and then that's not a true obstruction. Then there's something else. If you sedate the cat and you can press on the bladder and it just urinates, that's not an obstruction. So then you need to look at other causes for it, and it can be cancer. It can be even neurological causes, so if they have a bad spine, so it can be the nerves going to the bladder that's not working well, and when you sedate them, you can express the bladder. So there's other causes, and it's it's quite a big area, but you have to start somewhere and sort of start working it up.
Absolutely. And I mean, before I lose the opportunity, because there probably will be listeners that are going, okay, no, you told us all about the males, but like I've got a female cat, I want to know because, and I know it's a subject, and I think at some point it'll be worth us discussing cystitis in its entirety and go through the whole process. But just in summary, how, in terms of you now have a female, we know it's not a blockage. They're straining because they have an inflamed bladder. How generally are you managing those cases for owners?
So your first line should be, you should always do a urine analysis. You should always get urine. And it's sometimes difficult because sometimes the cats come to you and because they're straining, their bladder is empty. Yeah. So you can either admit them for a few hours and hope they don't urinate in those few hours, and you're able to get a...
So we take the litter tray away for a period of time, so there's no place for them to go.
Yes, yeah. And you also don't want to sample like off the floor, because then that also influences your results. So that's the proper way of doing it, is wait for the bladder to be a little bit full and get some urine and then test it. So you can see, is it bacterial? Is it there's just inflammatory cells, which it most likely is, or is it are there crystals? And it's not to say if they have a certain crystal that if they have stones, there's the exact same stone for that crystal. It can be different. So so with female cats, I would generally start with do a urinalysis. If it's not bacterial, I put them on an anti-inflammatory, and we change their food. We change them to a stress diet, basically, and then we see if they get it like in 2 weeks' time again. Then you can go X-ray and ultrasound and see if there's any other causes.
Anything else irritating their bladder?
Yes, and then there is some behavioral medication we can give them if they are stressed. Like we have a cat that the owners are moving and he blocked up again because he was stressed because of all the packing. And so we have him on now for a while just so he can get used to the packing and moving, and so that he doesn't block up. So there are ways that you can manage them with medication.
Okay, all right. And then obviously in the same sense, with the males, you're managing environmental conditions exactly the same.
Yes,
the pheromones, the multiple bowls, the multiple litter trays.
Exactly the same, yeah.
Yeah, that's great. So any like last bit of advice for owners who notice that their cats are straining? What is the take-home message ultimately?
Take them to the vet.
And promptly.
Yes, and especially if they're male cats. And like I said, you don't know if you have the rare female cat that's going to get obstructed, and that's a whole different ball game. But if they're straining, rather take them to the vet, especially if you don't know if it's urine, if it's poop, is it... Yeah, so we will work it up and see, is it coming from the bladder? Is it coming from the colon? What's going on?
No, that's great advice. I mean, either of them, all of those conditions are uncomfortable and need management.
Yeah.
So no, that's great advice. I'm so grateful for your time. Thank you. Yeah, like I say, you're a wealth of knowledge. It's always lovely speaking to you. And as a fellow cat lover, I know that this is one of your passion points. Yeah. And obviously, this being a really common and like emergency type situation, I think it's great to provide information to owners who didn't know quite how serious it is. So thank you so much for joining me today.
It's a pleasure. Thank you for having me.
Really great. Thanks, Dr. Inke. Thank you, Dr. Inke Helm, for your insightful contributions to our discussion on urinary tract obstruction in cats. Your passion for cats and expertise in this subject are evident. To all our listeners, we hope this episode has provided valuable insights into recognizing and managing this critical condition if you need to. If you found this information helpful, we kindly ask you to support the podcast by liking, sharing, and leaving me a review. Your feedback helps us improve and reach more pet owners with essential information. I'm Dr. Cara, thanking you for joining my journey to inspire, inform, and open up conversations for pet owners. Join us next time for another discussion on the Pause and Effect podcast. Until then, please don't forget to give your pets a hug from me. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help, and maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow, I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at drkara@pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.